Hello, everyone. My name is Eldriga Glover Hill, and I will be discussing the different roles of the nurse educator. At the completion of this learning, the student will be able to define the nurse educator role as an advisor, co-learner, mentor, and collaborator. Compare and contrast the different roles of the nurse educator. Identify learning examples related to the different roles of the nurse educator. We all know that nurse educators have different roles such as teaching, advising, learning, mentoring, and collaboration. Nurse educators help guide students through the entire learning process and help them be successful as nurses. Nursing education began with Florence Nightingale. She was identified as the mother of nursing. She established the first nursing school in England in 1860, where she acted as an advocate and humanitarian for sanitary conditions for soldiers in the Crimean War. From there on, Bellevue Hospital in New York City was the first school in the United States to follow on her principles. As an advisor, the advisor is an educator who must have the knowledge and skills to empower students. Advisors help build relationships and develop communications with students to help meet their educational needs and expectations. Advisors assist students with selecting courses, determining prerequisites, determining short and long range goals, and they monitor the progress of the students. The advisor must also be considerate of the student's lifestyle, since most students still work full time jobs. So they basically are there to give input on how to support them and partner with them on making good decisions. As co learners, nurse educators assist with exploring knowledge so that students can learn. As co learners, nurse educators make a commitment to lifelong learning by knowing the material that is being taught, problem solving, connecting with students, and understanding the way students analyze knowledge. Nurse educators can demonstrate co learning by working in small groups with nursing students, such as in clinical settings, in discussions, and even co learning with the digital age. The use of digital tools can be difficult to navigate, so nurse educators can reflect on their experience with navigating through the digital tools and collaborate with students to understand how they use technology. An example of co-learning is also staying up to date with the NCLEX exam. The NCLEX changes every 3 years, so nurse educators must stay up to date with evidence-based practices that help promote learning different formats that the student need to use. Mentors. Nurse educators are responsible for mentoring current and future nurses. Mentors help shape the career of nurses by promoting an environment that is caring, connecting, and just a person that is open to communication. Mentors are well respected in their area of studies. Mentors provide advice about learning, guidance on work life balance, and encourage students about personal matters. Mentors support colleagues by providing guidance, feedback, and support with teaching, research, scholarship, tenure, and promotion. Most mentors develop long-term trusting relationships with the relationships they have formed with others. Collegiality involves faculty working in a collaborative mindset to enhance student learning. Collegiality involves communication, participation in decision making, creating partnerships, and teamwork. Um, Collegiality can be used with the revision of nursing content, adding or removing of courses, balance of clinical hours, and strategies that promotes competent and safe nursing. Collegiality also involves working with state boards of nursing for passing rates and also stakeholders about different laws, hospital boards, and the community on how we can make better patient outcome, decrease the care of costs, and nursing job retention. In conclusion, nursing educators wear many hats and have many different roles. I relate advisor and mentor kind of as the same roles since they are advising and encouraging. And co-learning and collegiality work hand in hand with using a collaborative approach to work with students and faculty. And thank you. I hope you enjoyed this presentation.